We are today discussing on interesting cases of ENT. Myself, Dr. Vaishali Sharkar. My first case is a 56 years old female presented with facial swelling and dysphagia to dry foods. She reported intermittent episode of facial swelling, which is precipitated by salty food intake and stress, with each occurrence lasting approximately 24 hours. Swelling was not painful and elevated by food intake. The patient reported numbness of the skin overlying the right parotid gland. The patient also complained of itchiness and dryness of eye. She also gave history of Crohn's disease diagnosed earlier by gastroenterologist and reported a flare of inflammatory bowel syndrome associated with her oral and facial symptom. On examination, there was moderate swelling of soft tissue in the right parotid region, mild swelling of soft tissue in the left parotid and the submental region. No weakness noted in the distribution of facial nerve. Management. Based on the clinical suspicion for Mikulicz disease, the patient was started on titrating dose of corticosteroid therapy, artificial teardrop carboxymethyl cellulose, artificial saliva in the form of glycerin and sodium carboxymethyl cellulose given. 5 days follow-up done. There was significant improvement of symptom. Patient was able to eat without discomfort. Eye irritation reduced. Swelling of the parotid and the submental region reduced significantly, although it was there. What is Mikulicz syndrome? It is a chronic condition which is distinguished by abnormal enlargement of gland in the neck and head, which includes gland near the ear, that is the parotid, glands around the eye, lacrimal, glands of mouth, salivary, the tonsil and other gland in the soft tissue of the face and neck may also be involved. Causes and prevalence. The exact cause of Mikulicz syndrome is not known. It is suspected to be an autoimmune disorder. It is normally described as a benign disorder and it is considered as a form of Sjogren syndrome. The symptom of Mikulicz syndrome may occur due to excessive accumulation of certain white blood cell lymphocyte into many glands of the face, mouth, and or neck. It affects female more than males and most often present with during the middle years of age. The signs of symptom include sudden onset extreme dryness of mouth, that is called xerostomia, that lead to difficult swallowing of and tooth decay, enlarged tear gland, lacrimal gland leading to absent or decreased tear, and hard painless swelling of the salivary gland of the mouth and parotid. Submental and submaxillary may also become swollen. Diagnosis and management include biopsy of the swollen gland, that is essential to diagnose Mikulicz syndrome, and ultrasonography examination of the area may be helpful to rule the other reason of gland swelling. Treatment is symptomatic, directed towards the treatment of the underlying disease. Corticosteroid treatment given in the acute phase, surgical excision of the affected gland if it is needed. Artificial tear is given. Artificial saliva may be used to treat oral symptoms. Soft, moist diet is advised to reduce pain caused by chewing and swallowing. Other treatment is symptomatic and supportive. My second case is a 16 years old boy who is present with blackish discoloration of tongue for the past 5 days. It is not accompanied by any pain, burning sensation of the tongue. Patient give history of antibiotic therapy and steroid inhaler for recent lower respiratory tract infection. Examination of the oral cavity revealed blackish discoloration of the lateral aspect of tongue, including tip to side extent. Treatment. Here the patient is asked to maintain a good oral hygiene. 2% povidone iodine mouth gargle in the ratio of 1:1 dilution with water is given. Antifungal medication 150 milligram of fluconazole on 1, 4 and 7 day, and the patient is followed up on the 5th day of the treatment. There was significant improvement of the blackish discoloration of the tongue noted on the 5th day. What is black tongue? Black hairy tongue is a temporary harmless oral condition that gives the tongue a dark, furry appearance. Causes can be black hairy tongue typically result when projection on the tongue called papilla grows longer because they don't shed dead skin cells like normal, and this makes the tongue look hairy. Debris, bacteria, and other organisms can collect on the papilla and result in discoloration. Contributing factors: changes in the normal bacteria or yeast content of the mouth after antibiotic use, poor oral hygiene, dry mouth, regular use of mouthwashes, tobacco uses, drinking excessive amount of coffee and black tea, excessive alcohol use, eating a soft diet that doesn't help to rub dead cells from your tongue. Treatment. It consists typically doesn't require any medical treatment, though unattractive, it is temporary harmless condition. Practicing good oral hygiene and eliminating factors that may contribute to the condition, such as avoiding tobacco use or irritating mouthwashes, help resolve black hairy tongue. A word of thanks for your patience hearing.